there are a lot of children with special needs on the coast, and unfortunately we always have to send them out because we don't have very many pediatric subspecialists on the coast.
It was Christmas Eve, and I arrived home to find out that Harry has collapsed in the front yard. And we arrive at Memorial, which is our hospital. And the doctor looked at me immediately and said, "You have to leave tonight, right now, and your choice is either to go to New Orleans, Jackson, or Mobile, because his kidney has to come out immediately." It is a scary position to be in. When I look back and think that 20 years ago, I was faced with the decision of having to take my son out of state, away from my home hospital, the scariest part to me is that still exists today. If Harry got sick today, or your child or anybody else's, you'd still have to leave the city, this county, this area, to go get help, go get the medical help that your child would need, and that just shouldn't be the case.
So I was 4 months pregnant with our second child, and because I was over 40, I was considered high risk. So they told me I had to go to a phytologist, and we had to drive to Mobile for that. I was shocked to find out we didn't even have that here. So the news that the doctor gave us, the phytologist, was, "I'm very sorry, but I believe your son has Down syndrome and he has fluid on his kidneys, but the worst part is he has major heart deformation. He only had 2 chambers instead of 4 and 1 valve instead of 2. We were shocked that we didn't have the care here, that we had to go out of town or out of state to even get his heart surgery.
Memorial Hospital is a public, not-for-profit healthcare system based in Gulfport, Mississippi, and is jointly owned by the City of Gulfport and Harrison County. Memorial has expanded its services to the 6 coastal counties to meet the needs of our communities. But even though we've made great strides, we still don't have some of the vital services we need to treat the residents of the Gulf Coast due to lack of funding sources needed to expand our services. To meet these needs, Memorial plans to construct a multi-specialty center to house adult specialty services such as endoscopy, interventional pulmonology, pain management, and ear, nose, and throat, as well as pediatric subspecialties and procedures like heart, cancer, and surgical services. Additionally, the new facility will house a new telehealth center, expanded rehabilitation capabilities, and a new residency program, all of which will add to the economy and competitiveness of the Mississippi Gulf Coast.
I think it's critical, not just from an economic standpoint, but from a healthcare standpoint. If you have this battery, this expansive opportunity where folks know that they're going to be cared for, their family members and their kids in particular are going to be cared for, it makes it easier to make a decision to come here. So there's some opportunities here, not only for the folks who live here, but also people looking to move or relocate, whether it's businesses or individuals, that they can rely on an institution that's going to be there when they have a medical need.
So part of economic development in our county is that we try to get high-paying jobs, specialized jobs. With this, if we can get this wonderful place, think of all the physicians and their families that we can recruit because we would have this type of place.
We know here on the Mississippi Gulf Coast there are some underserved populations, and our goal at Gulf Coast Community College is to form this great partnership with Memorial as a community college. A real critical piece of what we do is to ensure accessibility. We have one of the largest nursing programs here in the state of Mississippi, and we have over 10 health-related programs. I think it's important when we think about the people that live and work in our community. At Gulf Coast, we have over 1,000 employees. Many of our employees have children. We would want to, as a partner with Memorial, make sure that we provide those pediatric subspecialty opportunities for our employees so that they can get that care that they desperately need right here in South Mississippi. People don't want to travel for those services, so we feel like we owe it to our community and our employees to provide those much needed services. It's very, very important to do that.
We hope that there would be a possibility to expand our operations and add more additional inpatient rehabilitation beds. It's not uncommon for us to have a long list of patients awaiting to come into our hospital, and we may only have 2 or 3 open beds on any given day.
So Children's of Mississippi, we are the only full-service children's hospital in the state of Mississippi. So whenever we go into a different part of the state, we always look to find a health system and physicians that we can partner with. We want to make sure that the patients and that community, wherever we go, is improving in their health care for children. So when we looked at the coast and the southern part of the state, we said Memorial Hospital Gulfport is the best partner for us to have. The new facility is going to be an outstanding addition to pediatric care for the coast. It's going to take what we already have down there, and we've been building for the last 7 or 8 years in partnership with Memorial. It's going to enable us to continue to advance some of the care and keep even more patients on the coast, provide space for more physicians to be down there, and it's going to provide both better care for those families, better convenience for those families and access to specialty care, but also provide an economic benefit to the coast. The community needs more of the services that we provide, so this facility will only enable us to meet more of the needs of that community.
To have a clinic here would just make things so much easier for our patients. You know, they wouldn't have to take a whole day off from work to go to New Orleans or Mobile. They would be able to maybe just take a few hours off and then go back to work. The child might not have to miss a whole day or two from school to do this. So it would be much better for our patients and for their families to have that care provided here locally.
The new center will create more than 200 new jobs, and with Encompass Health as a long-term tenant, cost for sustainability is achieved. But without funding from the Gulf Coast Restoration Fund, Memorial will not be able to complete the project, and thousands of coast residents will continue to have to leave our state to seek the medical treatment they and their families need. With your help, we can ensure that our residents will be treated here on the Mississippi Gulf Coast.
Thank you much. Cheese!